to Speak Our Minds, the fight for youth mental health, the podcast that delves into the inspiring journey of youth mental health advocates who took a stand and transformed a system. Together with your host, Heidi Baskfield, we'll explore the landmark lawsuit that held the state of Colorado accountable for failing to provide essential youth mental health services and won. In each episode, we'll unpack the intricate details of the lawsuit, guiding you through the legal battles and the monumental settlement that set the foundation for a working system of mental health. We'll examine the steps Colorado is now taking to build a comprehensive and effective mental health care system for its youth, highlighting both the challenges and the triumphs along the way. Join us as we learn from experts in other states who have successfully navigated similar crises, offering invaluable insights and strategies. Hear firsthand accounts from parents, providers, and professionals who are deeply committed to ending Colorado's youth mental health crisis. Their stories and perspectives will shed light on the impact of the lawsuit and the hopeful path forward. Whether you're a concerned parent, a mental health professional, or an advocate for change, this podcast is your guide to understanding the profound transformation taking place in Colorado's youth mental health landscape. Welcome to Speak Our Minds, the fight for youth mental health. Let's embark on this journey together.
Today, I want to introduce everybody to my incredible guest, State Senator and loving mother, Dafna Michaelson Jenet. Senator, thank you so much for being with us today. We so appreciate you joining us here at Speak Our Minds.
It's my honor, and thank you for all of the hard work that you're doing.
Well, and it is our honor to be able to engage in this work. And we're going to talk a little bit today about your very long commitment as a youth mental health advocate, and then in your role as a state senator, how that connects to the efforts currently underway with respect to the lawsuit and implementation planning and some complicated dynamics that lay ahead for all of this to be successful. So let's start off with, can we talk more just about why does this topic of youth mental health and work around youth mental health remain a dedicated focus for you? Because for others, it's trendy. For you, it is not. So say more about, where does this passion and commitment come from?
Well, thank you for giving me the opportunity to talk about the work that I love so much. And I first got involved in this work as a mom of a kid who really struggled, learning how to navigate the system for him and with him was very challenging. And I had all the greatest access in the world and all of the means to get him the help that he needed, and wasn't able to get him the appropriate supports that he needed in schools. And at the same time, I was volunteering at two of our juvenile correctional facilities, a boys and a girls facility. And I realized that the boys were very much like my son. If I wasn't able to be successful for my son, what chance did they even have of being successful in our system?
Right. Can you say more about, maybe give a couple of examples of some pretty significant obstacles that you encountered and what you attempted to do to course correct or find your way through and navigate?
Yeah, the biggest challenges were in school and in trying to find an appropriate IEP that actually reflected his needs. And every time we went into an IEP meeting, we came out with them saying that he should be able to spend 80% of his time in the classroom, and he didn't spend 80% of his time anywhere other than the office. So we weren't getting accurate answers. And it took us a long time. It took us till we got to children's when they told us that he was narrowly on the autism spectrum and that he was dealing with some very significant mental health disorders as well as learning disabilities. But it took his attempted suicide to be able to get us the help that we needed.
So I think it goes without saying that it is your hope for other kids that they don't have to go through what you and your son have experienced, and that's really what has consistently led to your engagement on this topic.
100%. And as I've been able to work in this area as a state senator, it has been very clear to me that so many kids are suffering in the same way as my child suffered. And my work is to help all of them.
Okay, so having gone through this with your son, I think people want to know, how are you and how is he doing now?
Well, he is doing great, just learning how to navigate early 20s. I am doing great as well. He still participates in therapeutic involvements. We still work as a family to make sure he has everything that he needs so that he can be productive in the community.
When you think about how much time you've spent on this topic and how much work goes into being an effective advocate, I mean, you've run for office and you have now spent time in both chambers of the Colorado State Legislature to bring about really significant change for other families and kids in this situation. How would you describe Colorado's system of youth mental health now? What's going well? What's not? How would you describe it all?
Oh my goodness, Heidi, there's so much work to do. There's so much work to do. And every year I feel like we add a little something here and a little something there. And we had the ARPA funding, which in theory is supposed to open our neuropsych treatment facility, which I haven't seen yet. We're constantly trying to open more beds and make more space available. It feels like a never-ending challenge. And I'll tell you, when we went through the Families First process, I feel that also put a significant kink in our system that we did have, because many kids found themselves without a placement.
It's worth noting here that when Senator Michaelson Jenet is talking about so many kids going without placements, what she's really referencing is that in the state of Colorado, over the last decade, we've lost over 1,000 mental health beds serving kids in this state. This is further exacerbating an already massive problem of too many kids being stuck in situations and in places like hospital emergency rooms that shouldn't be there anymore. In fact, according to the Colorado Behavioral Health Administration, in the first quarter of 2024 alone, 569 Colorado youth got stuck in either an emergency room or an inpatient setting because there weren't the services there that they needed.
Which, at a time when there's this state of emergency for youth mental health, there's a growing recognition about the crisis. You wouldn't think that it would take so much effort to be able to make progress. Why do you feel like it's been so consistently difficult to make progress in this space?
I have a lot of thoughts on that. And most of the thoughts revolve around money and the pecking order for money. We live in a Tabor state, which means we return any overage over a preconceived amount of money to the taxpayers, which sounds great until you realize that you can't pay for the systems that you need to put in place to take care of your community. It's constantly a battle for education dollars and hospital dollars and behavioral health dollars. And behavioral health has been lower on the pecking order. I feel that we've been able to elevate mental health and behavioral health to a higher level and to a earlier investment opportunity for the state, but we have a long way to go.
Sure.
It's useful to share that according to a 2020 report conducted by the Colorado Health Institute, Colorado spends roughly $404 million on youth behavioral and mental health services. That reaches across 6 agencies and 34 programs. What's also interesting, that while 41% of those dollars can be accounted for in actual provision of service, the remaining percentage is attributed to the broader category of unknown. So when the senator talks about the state having a lot of work to do, part of that work is in being able to understand where we spend that money, how we can assure it's reaching towards high quality and effective outcomes that actually increase access to care for the kids who need it.
Do you feel like your legislative colleagues are similarly interested in having this look different?
I think they are. I think that there was a lot of education that needed to happen, and people needed to understand the system and what wasn't working in the system and who wasn't being treated and who wasn't being cared for and what that meant for our community. A lot of education had to happen, but I think that that education has happened. And I do believe, because every time I have stood in front of my body and asked them to approve money for behavioral health, they have done it.
Which is significant at a time when there are a lot of competing priorities. I understand that. Let's shift focus just a little bit. So we have this lawsuit now, and the state having agreed that it needs to come into compliance with the EPSDT requirement under Medicaid, which is now resulting in this wholesale system reform effort to ensure that Medicaid recipients ages 0 to 21 get what they need when it comes to their mental health service. What do you feel about, when it comes to the lawsuit, what do you feel like the benefit can be that comes from this body of work that maybe didn't exist before? Is there a new opportunity that this creates?
I think there's a huge opportunity that this creates. And I will tell you, the one bill that I didn't get passed was that system of care bill that we ran last year that we would hope would have addressed in part or in whole all of the responses from the lawsuit. And now HCPF has their opportunity to put a system of care in place. And I'm hoping that we laid some of the groundwork by showing them what we want.
And when you say things like system of care, there are groups of people that understand what that means and what that is. But for maybe your average parent or business person or just sort of committed individual that doesn't necessarily know all the jargon, can you say more about, from your perspective, what does a system of care mean and how would it result in anything being different going forward? If we have a successful system of care, what does that mean for your average person and accessing services?
I believe a successful system of care looks at the child from before they ever need to enter the system and starts working with the child before they've entered the system to possibly avoid having to enter the system. But if they need to enter the system, the services are there at the right level of care, at the right place, at the right time for that child all the way through until they have some healing and are ready to return to the community. And, that doesn't mean taking a child away from their parents, but it means taking a child and giving them access to the best comprehensive care possible. And when you start in an intensive care setting, that you have step down opportunities as well. To me, that's what a comprehensive system of care would do.
And I think families would wholeheartedly agree with you, Dafna, that we absolutely need to be thinking as far upstream as possible and ensuring that the services come online at any point throughout a young person's journey to be able to support their mental health needs. As HCPF is putting together this implementation plan, I actually think we have some very committed individuals within the department that would like to see very effective change take root and create meaningful difference. I think what is often a challenge in state departments is being able to run a process that allows for effective engagement with stakeholders, which means not just being on tour with listening sessions and sharing a plan and saying, here's what we're doing, but really building a plan that is reflective of what stakeholders say that they want and need. How can the department do this well with this process, and sort of what's at risk if they don't, from your perspective?
Yeah, that's a really excellent question. I agree with you. I believe that there are many in HCPF who care very deeply and want to see a system of care put into place that responds to the needs of all of our youth. I think that in order to really include the community, there need to be working groups. The governor has put together in the past a behavioral health care working groups. And
Sure.
ultimately, I would think we need some version of those working groups again to be able to come to a stakeholded and really well meted out plan. And what's at risk if we don't is not solving the problem.
Right. Like just winding up in the same place all the time.
Yes.
And when you think about some of the more engaged individuals, there are people who have dedicated, like you, their lives and their careers to doing this work and have shown up at previous engagements and have not always seen the fruits of their labor, so to speak, translate into meaningful change. Do you feel like there could be a difference with this? Like it's worth being at the table because change could come? Do you see something different here?
Yeah, I do believe because of the lawsuit, quite frankly, that we have a greater opportunity to make change now than ever before. And I think people should come to the table and should fight to be at that table.
And what kind of groups are you particularly interested in making sure are both heard and then have their input very formally incorporated into this implementation plan that the state is responsible for creating?
I think we need to hear from both patients and parents. I think we also need to hear from providers who see the system for what it is and what it could be. I think those would be excellent groups to have at the table.
I agree with you. And we're committed to making sure that all kinds of different groups have a voice in this process. And I think what is going to be difficult is walking that line. The department has a hard job between creating an effective plan and meeting timelines, but doing so in a way that's responsive. So I don't think any of us underestimate what is a complicated process, but I know it's going to take all of us pushing for that process to be as open and expansive as possible. How do you feel like you and your colleagues can ensure that a really stakeholder-driven process is done well?
Well, I think it's incumbent upon me and my colleagues to be paying close attention to what's happening, to following the progress, to getting regular updates from HCPF, and to be leaning on HCPF to be including the community if that is not indeed the case.
Have you heard from them to date about where they're at in their planning efforts or what their expectations are and what they're hoping to accomplish?
Not since May.
It's worth pausing here just to be able to take a moment to talk about the significance of the role of the Colorado State Legislature in being able to advance whatever it is state Medicaid attempts to create with its implementation plan. In other states where similar litigation has succeeded, these states end up spending upward of $300 million new dollars to build a functioning system of youth mental health care within their Medicaid system. What's shocking here is that legislators who are critical partners to the department in being able to comply with the settlement agreement haven't even been briefed yet about the lawsuit, the outcome, or the role that they need to play with respect to helping the department advance the implementation plan. As we record this podcast, the legislature is holding a special session to be able to navigate a very tenuous budget situation. And if they aren't successful, the amount of cuts that will come to the state budget will have a significant impact on existing programs, let alone what is hoping to be built moving forward.
And the last time that you heard from them, sort of what was the general tone of their thinking and how they plan to roll things out going forward?
Well, I think they were hopeful that the new components that they had put online just before the lawsuit was settled would be starting that process of creating the system that we need.
What's your expectation for how the department should engage you and your colleagues in this process? Like, what do you hope that sort of channel looks like?
Well, I hope that they communicate with us regularly and ask us what we think about how it's going and tell us how they see it going from their perspective.
Well, that makes perfect sense to me. That takes us to this next point, which is going to be a really complicating dynamic that both the department and you and your colleagues are going to have to contend with as we move into more of the actual implementation that comes from the plan. And that is the state budget is in a serious state of constriction. And I think we all know that large cuts loom. And anytime you're in an economic downturn and large cuts are having to be contemplated, that bringing new services online and expensive services is what feels like a very significant uphill challenge. How can the work to advance the implementation plan still happen in that environment?
Well, while the budget is in a state of constriction, we need to be fighting every day for the dollars that are available to be put towards this. And I think that this is the case of the squeaky wheel. We all got to be squeaking a lot at our joint budget members and at our other colleagues in the chamber to explain why funding needs to go here now and not later.
Right. What do you think is at stake in a system that we've already had state acknowledgement that we don't effectively meet the needs of youth as it comes to their mental health? This mentality that, oh gosh, we've got a constricted state budget, we're having to make cuts, so we're going to have to kick some more of this work down the road until things look better. Why is that, in your mind, particularly problematic with respect to this topic?
Because we don't have time. We simply do not have time. Every minute that we delay putting into place the appropriate system of care is time that another child doesn't get help, and another life could be lost, another youth end up in the hospital emergency room. We have children all over the place waiting for care, and we cannot sustain that.
Right. Do you think your colleagues, either on the Joint Budget Committee or in general in either chamber, have an awareness of the lawsuit and the obligations stemming from the agreement that's been reached as a result of the lawsuit?
I don't think that many of them are fully aware of the lawsuit and the implications. And I think that it's incumbent upon us and incumbent upon the stakeholders to educate their legislators and make sure they know not only what happened and what has been promised, but also that they as constituents are watching and are working on this as well.
I agree. And I also feel like at this time when, we have growing complexity with the economic environment, that it's going to take all of us at the table working together to ensure for both not just the effective development of the plan, but its funding and implementation. That state Medicaid really needs partnership that comes from legislators like yourself and stakeholders to be able to move things along effectively. Like that can't happen absent action on behalf of this broader community. Would you agree? Am I missing anything on that?
I don't think you're missing anything. I think this is the state we're in.
If you were to look around at any other states or hear of other stories, because you are well known for your mental health advocacy and people from all over the country talk to you about what they see and do and policy ideas that you can bring to improve things here in Colorado. When you think about that landscape, are there any other states that you would point to and say, wow, it would be great if we could spend more time partnering with that state and thinking through how to implement some of their successful strategies in this effort here in Colorado?
Yeah, absolutely. I mean, we've been taking a good hard look at New Jersey as a model that we should be able to bring here to Colorado, and that seems to be working. So I'm hoping we'll continue to look at New Jersey. And as far as other things are concerned, there are programs and pieces that are taking place in places like Texas and Utah that are interesting and different that we might look at as part of the work we're doing as well.
That's super helpful. And similarly, we often point to the success that New Jersey has had in the model that they continue to grow and expand and improve upon. as a good partner for us to work with as we advance our own model. If you had to say sort of anything in parting thoughts to people who are listening to this, hoping for guidance around, here's how to engage a legislator on this topic, or here's why it's important for me as a stakeholder to stay engaged. This isn't just another blue ribbon commission or just another task force. What are some of your parting thoughts that you want to share with listeners?
Well, I think we're at the point where the rubber meets the road. And if you want to be involved in making sure that the system we put in place looks like a system that serves you and your family, it's time to get involved now. And the ways that you can get involved are find your legislator. If you Google Colorado State Legislature or find my Colorado State Legislature, it's on the website leg.colorado.gov. There's a button right on the front page, and you can find your person, their phone number, and their email address so you can communicate directly with them.
That's fabulous. Is there anything that has you particularly hopeful? Like, this is the big hopeful takeaway?
I think the big hopeful takeaway is that there are people like you, Heidi, and the community surrounding you that are working really hard to make sure that this goes right. And I believe that it will.
Well, I do too. And that's because we also have champions like you sitting over in the legislature. So Senator Michaelson Jenet, thank you so much for being with us, for giving your whole life to be an advocate for this topic, and we can't do it without you. So thank you again. And we'll look forward. We hope you'll come back and talk to us as things continue to evolve, because we'd love to hear your perspective on how things are going and how you're hoping that others continue to engage and support the work that you're pushing through your specific channels there in the Senate.
Absolutely. And thank you for that opportunity.
Thanks so much for joining today, and we'll talk again soon.
Thank you for joining us on this episode of Speak Our Minds, the fight for youth mental health. We hope you found today's discussion insightful and inspiring. The journey to transform Colorado's youth mental health system is far from over, and your engagement and support are crucial in sustaining this momentum. If you have any questions, comments, or stories you'd like to share, we'd love to hear from you. Connect with us on social media or visit our website at www.speakourminds.org for more resources and information on how you can get involved. Don't forget to subscribe to the podcast on your favorite platform so you never miss an episode. Together, we can make a difference and ensure that every young person in Colorado has access to the mental health care they need and deserve. Until next time, stay informed, stay engaged, and keep advocating for a brighter future. The Fight for Youth Mental Health with your host, Heidi Baskfield. Thank you for listening.